I now take this pressure and honor, Honorable Minister, I invite you to come and address on the journey of our various investments in the health sector, or how far we have gone on the issue of delivering health and the various commitments that we pledged to Ugandans within this manifesto of 2021-2026. So, Honorable Minister, you are most welcome. Thank you. Please join me to welcome the Honorable Minister.
The Chair, NRM Manifesto, and your entire team, members of the media, my team members who are present, ladies and gentlemen, good morning to you all. I am waiting for my presentation to go on the screen. Oh, okay. It has now gone on the screen. Thank you very much. So I'm going to take you through progress in the implementation of the NRM Manifesto, and specifically, we'll be looking at the health sector. In the layout of my presentation, that is the first slide, please. The layout of my presentation, I'll give you an introduction, and then we shall go to the vision, mission, and goal. And then we'll begin the progress on the manifesto commitments, starting with health infrastructure. Then we'll look at human resources for health. 3 will be availability of medical and health supplies. 4 is prevention and control of non-communicable diseases. 5 will be prevention and control of communicable diseases. 6 will be reduction in maternal, neonatal, and infant mortality. 7 will be support research and development. 8, we shall be looking at oxygen plants. 9 will be dealing with counterfeit medicines. And then we'll conclude by looking at our plans for financial year 24-25 and the medium term. So as a way of the aspiration of Agenda 2030, that is Sustainable Development Goal 3, which is what the health sector looks at, and Goal 3 of Agenda 2063 of the African Union, call for ensuring healthy lives and promoting the well-being at all ages of our population. Uganda aspires to see her citizens enjoying a high-quality standard of life by improving the health status as highlighted in Uganda's Vision 2040. Within the National Development Plan 3, the health sub-program falls under human program pillar. It is discussed under Objective 4 to enhance the productivity and social well-being of the population. The health program, however, mainly contributes to Objective 3 of the Human Capital Development pillar, which is on health, safety, and management. Our goal as the health sector is a healthy and productive population that contributes to socio-economic growth and national development. Now, our mission statement is to provide high quality and accessible services to all people in Uganda, including addressing broader determinants of health to attain socio-economic development and a prosperous life. And our goal is to ensure access to adequate and quality health promotion, disease prevention, treatment, palliative care and rehabilitative services, and achieve universal health coverage target of 90% by 2030. After that introduction, I will go straight to our commitments as per the manifesto. And as I indicated earlier, we shall start with health infrastructure. The first commitment was theaters and wards in 37 health center 4s without functional theaters. The status is as follows. In financial year 21-22, funding was allocated to local governments for renovation of 4 health center 4s, that is Kazo, Apapai, and Kumi. And these center 4s were renovated. Funding was also availed for construction of theaters in 30 health center 4s. In 3, we out to renovate and construct theaters of 13 health center 4s, which was also accomplished. Now I'm leaving you to add 4 plus 30 plus 13, and then we shall know the total number. In financial year 24-25, we carried out the upgrade of Muko Health Center 4 to a general hospital. The process is still ongoing. It is not yet concluded. We also began the refurbishment of Amolata Health Center 4 and completion of rehabilitation of Awohe and Semuto Health Center 4s. However, I must state here that challenges still exist. Funds remain inadequate for renovation and construction of theaters in all the 37 health center 4s, but good progress has been made. Number 2, still health infrastructure. The commitment was to construct at least 500 staff houses for health workers at health center 3s and health center 4s. The status so far, a total constructed and over 100 have been. There is a challenge attached to this. Less than 10% of staff housed at the health facilities. Most of the in some of the areas, the staff houses are not occupied. Now is construction and 5 equipment maintenance work. Is Gulu maintenance workshop was equipped through financing project by NEBO. The remaining 4, that is Masaka, Mbarara, and Kayunga workshops, are not yet constructed of funding. So we achieved 1. However, take note that the majority of the 16, we have 18 regional referrals. 12 of them have maintenance workshops. Number 4, the commitment was to complete and commission a state-of-the-art National Medical Stores warehouse at Kajansi in Wakiso. The status is that this warehouse was completed and it was commissioned by His Excellency the President on the 5th of November 2022. And that is where our services are being rendered from. Number 5, the commitment was to increase access to specialized healthcare services by construction, rehabilitation, and equipping of hospitals and super specialized centers of excellence in line with the National Health Policy. Part A, under the physical and technological infrastructure at the Uganda Heart Institute, that is in line with specialized centers. The status is as follows. Uganda Heart Institute was allocated 10 acres of land at Naguru by Uganda Land Commission to construct a new facility. Government has secured a loan of 70 million for the construction works to commence. The money has matured. Construction works will commence in January. Right now, the contract is being signed. I'm concluding that because my technical teams didn't conclude it. And we have set the date of January to give an opportunity for the president to come and commission. Right now he's very busy with the regional tours, so we cannot again divert him. Part B, construction of regional cancer centers in Arua, Gulu, Jinja, and Mbarara. The status, but hopefully construction will start early next year. Part C was construction of the Orthopedic and Trauma Institute at Mulago. Naguru National Referral Hospital was earmarked to be transformed into a trauma center for the nation. The status is that with support of the Chinese government, renovation of the current existing building will start early next year, and its transformation into a trauma center will follow immediately. We are only waiting for more land because what we requested for is big. Part D is completion of Lubowa International Specialized Hospital. The status is work is ongoing at about 45%. Now, when I say 45%, most people may not know, but let me state here that we are on the 6th floor. So you are welcome to go and see for yourselves the status of Lubowa currently. The new completion date is 30th December 2025. Part E is renovation and expansion of Soroti Regional Referral Hospital. Here the status is that currently the permanent secretary is in Japan. Conclude on the negotiations, and immediately early in the year this will commence. Part F, upgrading of Kayunga and Yumbe General Hospitals to a referral status. These upgrades were done. Kayunga and Yumbe are fully functional as regional referral hospitals. G, expansion and upgrading of Kapchorwa General Hospital to a regional referral. This one is still pending due to lack of funds. Then last, upgrade of some regional referral hospitals to a national status, also not done due to lack of resources. I, equipping of 6 regional referral hospitals, that is Gulu, Mbale, Hoima, Bombo, Kawolo, Moro, to CT scans and equipments. Let me state here that 14 regional referrals. Originally the plan was 6, however 14 regional referrals were equipped with CT scans. J, completion of Bukwo and Buwenge General Hospitals. Funding has been provided towards completion of Buwenge General Hospital during the last 2 financial years, and it is still in progress because the money is not enough, but government continues to provide it every financial year. K, construction of a general hospital each in Wakiso District and Rubaga Division in Kampala. This one has not been achieved. Funding has not yet been provided. renovation and equipping of 15 general hospitals. Here the status is that we concluded the renovation of Gombe General Hospital, and it was commissioned by the Right Honorable Prime Minister. Renovation and expansion of Busolwe commenced in 2022 and is, I think it is at 95%, not 86. I request that we correct that. It is only a small part in the staff quarters that is left. Inadequate funding to one renovation, which requires overhaul utility systems, is also a challenge there. Upgrading of Kisenyi, Kotido, and Chegegwa Health Center 4s to general hospitals. Kotido and Chegegwa Health Center 4s were upgraded to general hospitals in financial year 2022, and they are operational as general hospitals. We are waiting for formal approval from KCCA for the upgrade of Kisenyi Health Center 4 because it also requires additional land. N, construction and equipment of 136 health center 3s in sub-counties without any health facility. The status is that construction is ongoing at Kichwamba, Kataraka, and Katerera. We take note here that funding for construction in the remaining sub-counties still needs to be secured. Many of them increased. Center 3s to Health Center 4. The status is that Kawala, Bondo, Center 3s were up Center 4s. Upgrade of Chira Health Center is ongoing. Construction in when I mention theater is ongoing, it is on its way for upgrade. Health Center 4s. However, due to inadequate funding, upgrade will be undertaken in a phased manner as resources are made available. P, increase access to primary health care services by completing the upgrading and equipping of the remaining 41 health center 2s of the 331 health center 2s earmarked for upgrade to health center 3s. Since financial year 2018-19, 412 health center 2s have been upgraded to health center 3s under the UGIFT program and the AMCHIP program. There was a delay in recruitment of health workers to operationalize these facilities, but the recruitment has been concluded and the facilities have been fully equipped. And so the facilities are ready to give services to the people. So just to summarize, that government has upgraded 412 health center 2s to health center 3s. The next area that we shall address is human resources for health. Our commitment, number one, was to focus on enrolling and facilitating critical specialists and supportive staff needed to improve the status. 47 senior consultants and consultants were recruited in financial year 21-22 and posted to various referral hospitals. In financial year 22-23 and 23-24, there was a general wage enhancement for all health workers. following a payroll validation. More consultants are set to be recruited in this financial year. However, we have a limited number of specialists in some disciplines, notably pathology, anesthesia, and radiology, that need an affirmative action through provision of scholarships. 2 was to provide scholarships for training specialized and super specialized cadres for Mulago and the regional referrals. The status is so far 99 masters and fellowship scholarships have been awarded. In addition, 41 scholarships for bachelors of anesthesia were awarded under the AMCHIP project. 80 health workers are undergoing specialist training in various fields at the International Specialized Hospital Training Center in Lubowa. Let me state here that there is a training center in Lubowa the construction was concluded and it was commissioned and it is training health workers. 3, continue to enhance health workers' salaries and other benefits as the economy expands and generates more revenue. The status here is that health workers' salaries were enhanced in financial year 21-22. The focus now is to ensure performance for provision of quality services. The ministry has developed and disseminated key performance indicators for the core cadres to enable us monitor their performance. Commitment 4 was to facilitate local governments to recruit skilled health workers to achieve at least 80% of the current staffing levels. The status is that the current staffing level is 31%, but this is based on the revised structure. And I need to explain this. At the time of this commitment, we were working on the old structure for human resources, which was at 75%. During the manifesto drafting, His Excellency the President directed, and many of you may have heard him during the budget speech, that we need to prepare to recruit medical and other cadres up to the level of a Health Center 3. Hence, the infrastructure upgrade at Health Center 3s and the revision of the structures to enhance human resources at Health Center 3s. And therefore, we are giving this staffing based on the revised structure, which allows for medical doctors up to a Health Center 3 and other cadres. However, if we were to base it on the old structure, we would be at about 79%. Furthermore, additional wage is urgently required to recruit medical superintendents to improve supervision and management of the health facilities. So when you construct, when you expand, you need managers to manage these facilities. And that is what that update is talking about. Our commitment number 3 is availability of medical and health supplies. The sub-commitment number 1 is to deal with the problem of stealing of drugs through better supervision at sub-county level. The status here is the medicines delivery at health facilities is witnessed by a representative of the DISO, the Health Unit Management Committee, and the police. We have been slow to establish the LAN due to network issues. This is a network monitoring facility for us to monitor our drugs up to the beneficiary. But as government continues to install the cables we will address that. Number 2, digitizing the logistics management information system to improve accountability, because it will offer a seamless connection between national medical stores and health facilities. Here the connection is, the status, integration of the NMS client self-service portal has been done, and all health facilities are ordering online. 2, the ELMIS is integrated with the comprehensive Ministry of Health National Health Data Warehouse and the PIP to facilitate commodity accountability, among others. 3, the integration of the EMRS. These are software systems that we are using in the various facilities, and Clinic Master has been initiated to allow for visibility of health commodities at the hospitals. I think I need to explain this for members to understand that we started the process of digitizing our health facilities to connect them to national medical stores, and so far we have concluded with the national referrals, and a large number of the general hospitals and a few center for systems they are using there is called EAFIA and the Clinic Master, and these are connected to the National Health Data Warehouse, so that at a click of a button, in terms of commodities, in terms of human resources, and other services. However, this is not yet down up to the level of a Health Center 3, which is our aspiration, and which was the undertaking in the manifesto commitment. I hope that makes it clear. Number 3, increase community awareness on embossment of government medicines to check theft of medicines and discourage pilferage. The status is that all our medicines are embossed before distribution. 4, enhance health education to avoid preventable diseases through sensitization on immunization, sanitation and hygiene, good nutrition, exercising, road safety, responsible use of medical drugs, sex education will continue to be promoted to deal with teenage pregnancy. Status is that this is ongoing through the various media and engagement of cultural leaders, youth, community groups, and the religious leaders. Furthermore, the national health education and promotion calendars were developed and disseminated to all local governments and partners for provision of harmonized messages. Manifesto commitment number 4 was on prevention and control of non-communicable diseases. And these are a group of diseases that include the cancers, hypertension, diabetes, accidents, and so on. Our undertaking under that commitment, number 1, was scaling up services for screening of cancers of the cervix, the breast, and prostate at the earliest opportunity at both private and public health centers. The status is that cervical cancer screening services is offered in all regional referral hospitals, those are 18 all over the country, general hospitals, and a number of health center 3s, including the PNF facilities. Breast cancer screening is being carried out. We are promoting self-examination, and health workers have been trained to do breast examination on eligible women. But let me say that we have mammograms at Uganda Cancer Institute, at the Women's Hospital, and we are looking at rolling them down to all the regional referral hospitals. Prostate cancer screening is ongoing through tumor markers, especially at Uganda Cancer Institute and Mulago Regional Referral and and specialized. The availability is still low. However, as constructions of bigger laboratories in the regional referral hospitals continue, this will be rolled out. Undertaking number 2 is to encourage regional screening, regular screening for non-communicable diseases like cancer, diabetes, and heart disease. The status is that this is ongoing during health education and promotion activities. Let me state here that Uganda Heart Institute moves down to all regional referral hospitals to carry out screening on a regular basis. So does the Uganda Heart Institute and the Uganda Cancer Institute. But also for all of us to note that Uganda Cancer Institute has a mobile van that is taken to different regions of the country all the time to carry out screening, identification of cases that are then referred appropriately either to the Cancer Institute here or to the Gulu Cancer Center. Screening for diabetes has been rolled out up to the level of a health center 3. And you're free at any one time to go, take your blood pressure, and get your blood sugar tested for you to know your status. Of course, one of the challenges is the issue of medical equipment, because the equipment for diabetes and checking blood pressure are disposable and they continue to break down all the time. Number 3 is immunization of young girls against cancer of the cervix. The status, July 2022-2023, that financial year, the HPV vaccination registered a second high record of 157.1%, that is the first dose, and 74%, that is second dose, from 56% in financial year 21-22. This is just to show you that our girls are getting vaccinated. And we are very sure that by the end of this financial year, our coverage will be at over 85%. Of course, there is a dropout, especially girls that are not in school, and it is difficult to trace them. But we continue to sensitize the parents to ensure that their girls are brought for vaccination. Number 4 is revival of physical exercise days in schools, institutions, workplaces, and nationally. The status is that National Physical Exercise Day is conducted annually since 2011, and this is done in June by the Ministry of Health. IEC materials were designed for school health awareness campaigns targeting adolescents and young people in and out of school. We have developed guidelines on physical activity covering all age groups, but also in addition, what is not captured here is that through the head of civil service, all local governments are required to carry out physical activities in their various areas of jurisdiction, and they are all aware. Furthermore, we continue to give sensitization and messages to encourage Ugandans to continue with physical exercise. Perhaps it is important for all of you to know that Uganda is regarded by the World Health Organization as one of the countries where physical activity is highly performed. 5 was to create public recreation, that is fitness and health areas, particularly in urban areas, through public and advise the population on nutrition. The status is that this is ongoing by the private sector. Many health clubs have been established. Lack of health clubs in rural areas and for informal sector, largely due to the high costs attached. But I can ably say here that the majority of the people in rural areas use school compounds to carry out physical activity. The guidelines on nutrition was developed and launched by His Excellency the President in the Physical Activity Day, that is 2 years ago, and it has been disseminated to the local governments to make them available to all who need it. I'll now move to Manifesto with prevention and control of communicable diseases. And we'll start with HIV/AIDS. I'll start with HIV/AIDS. Ladies and gentlemen, let me say here that we are on track to achieve the 95, 95, 95 targets for HIV elimination. Our ART coverage is at 98%. We have 1,403,603 people who are on treatment out of the 1,433,337 people living with HIV/AIDS. Our coverage increased from 91% in 2020 to the current 98%. So for ART coverage, we are above the 95 target. The percentage of HIV-exposed infants with the first DNA PCR test, those who have tested positive, within 2 months increased to 91%. That is 64,108 out of 70,666 exposed infants, from 71% in financial year 2020-2021. We take note that HIV infection rate is rising, especially among young girls, 14 to 24 years. Retention on ART declined to 77% from 83% in financial year 21-22. But let me state here that we are also carrying out a new population impact assessment that will give us the current correct figures. In regards to TB, significant strides have been made to control the TB epidemic through the implementation of the National TB and Leprosy Strategic Plans 2020-2021 to 2024-2025. The update here is that we have accelerated TB community awareness screening and testing, what we call the CAST TB campaigns. I will explain a little bit what CAST means. CAST means we go down to the communities all over Uganda and encourage all who are coughing, who are falling sick from the communities to give us sputum, and at the same time we carry out X-ray screening using digital X-rays. Whoever is found positive is started on treatment and the entire household is followed. These campaigns are carried out every 6 months, and this is an intervention that we are confident will lead us to identify cases of TB within the communities, starting them on treatment and following them up. We have also improved diagnosis. We We have 1,765 TB diagnostic and treatment equipment, including 688 gene expert machines distributed all over the country. We have 5 mobile TB clinics. These TB clinics have digital x-rays. They also have gene expert machines to facilitate quick and timely diagnosis. They move in the regions where they have been deployed. We have in Lango, Bugishu, and Ankole regions, and 2 in central regions. Again, the idea is to help us identify the cases as quickly as possible and start them on treatment. Our major challenge in the area of TB is the rising burden of multi-drug resistant TB, which occurs when people default from treatment. So we have already started a very intense program of ensuring that clients who are on treatment are followed up on a daily basis. There are pictures there for you to see. The first is the trucks, the mobile clinics with the digital x-rays that we have deployed, currently 5 in number. Lower down was an engagement for TB prevention and control with the various MBs. And the next picture shows integrated TB community awareness campaigns, that is the CAST campaign. We set up anywhere in any region, and I think this one was set up in Moroto. The next is malaria. Several interventions are being implemented to protect the population against malaria. And I will try as much as possible to summarize and again to explain. 967,440 houses, that is 82% out of the targeted 1.1 households were sprayed. Indoor residual spraying, protecting 2.9 million people. Now let me state here that indoor residual spraying is only being carried out in eastern Uganda, covering a total of 12 districts. Number 2, we continue to distribute long-lasting insecticide-treated nets, and we carried out this last year. We distributed 28 million nets across the country. We are going to preparing to distribute nets in the next 2 years. 99.9% of vulnerable households own at least one insecticide-treated net, compared to 60% in 2011. We also continue to distribute mosquito nets through the antenatal clinics to mothers and children. Still on prevention of communicable diseases, I will now move to disease outbreaks, but before I do that, I think there are other areas which were not captured here, particularly larviciding that is being carried out now in 20 districts across the country. Apply larvicides to stagnant water where breeding takes place. Vector control for the mosquitoes. In addition, we need to stress the aspect of behavioral change, including around our home, and ensure that we don't have stagnant water. We cannot forget a very special intervention, which is test and treat immediately. Our country has never run out of anti-malarials. We are treating. But we also carry out seasonal malaria chemoprophylaxis, especially in areas where The breeding seasonal, especially where we have been carrying out seasonal chemoprophylaxis at least twice in a year. Now, when I go to the port health units, those are entry points at the borders, have been established at 2 high volume points of entry, that is Malaba and Busia. When we say it has been established, we mean there is a fully fledged screening place with everything that is necessary, including computerization for data collection and health workers deployed, and infrastructure built, including accommodation for health workers. Construction of Chanika, Vura, and the Lego health units are nearing completion. The Entebbe isolation ward was completed, equipped, and has been handling all public health emergencies, including the current monkeypox. There is a picture there for you to see. That is accommodation at the port health units. Commitment number 6 is to reduce maternal, neonatal, and infant mortality. Here the undertakings was that every sub-county should have a functional health center 3 with qualified staff, a well-equipped maternity ward to increase access to family planning services, antenatal care, basic obstetric care services, and postnatal care services. The status, 381 Center 2s were upgraded to health center 3s. I think I summarized this earlier on, and we noted that 412 health center 3s have so far been upgraded. And there was another undertaking that we transition 37 health center 3s in refugee hosting districts. These were being catered for by the UN High Commission on Refugees. However, they have now been transitioned to government. 1,696 out of the 2,184 sub-counties and town councils now have a functional health center 3, leaving only 488 sub-counties without health center 3s. This was a huge investment by government through the UGIFT and the AMCHIP projects. PHC non-wage recurrent grant and essential medicines have been provided to operationalize all these health center 3s. Up to 3,000 mothers attending the 4 minimum antenatal care visits, 1,800 mothers. This is only the new facilities that I'm talking about, not the entire country. 1,800 mothers are delivering from the new health center 3s alone. There has been a reduction in referrals to the health center 4s and improved health care outreaches to communities. Challenges: we need funding to conclude the 488 sub-counties without health center 3. I think that addresses the issue of new sub-counties and town councils that have been created. The other goal was to reduce the high maternal death due to hemorrhage and other causes like ruptured uterus through installation of blood fridges in 89 health center 4s, so that when mothers go to deliver, blood is readily available. The status: first of all, maternal mortality has reduced to 189. This is as per the Uganda Demographic Health Survey, which was released in the last financial year. It is still below the 2030 SDG target of 70 per 100,000. We are hopeful that we shall move there. More public and private health center 4s have blood fridges, 108 were installed in financial year 2020-2021, and 132 in financial year 22-23. Health center force providing cesarean sections and blood transfusion has increased from 50%, that is 108 out of the 218 in financial year 2020-2021, to 64%, that is 132 out of the 254. Take note that the numbers continue changing as we continue upgrading and constructing new ones. The challenge is inadequate funding to procure more refrigerators to complete the others that are left behind, and also challenges with availability of power, because some health center force are in areas without power. Chair, I request that I take a bit of water. Fully operationalized theaters at Health Center Force to provide surgical care, recruit additional 50 medical officers, 89 anesthetic officers, 124 anesthetic assistants, and 51 theater assistants. The status is that this is ongoing based on availability of wage. A total of 170 out of 195 public health center force kindly conduct cesarean sections. The challenge obviously is inadequate wage, as I mentioned earlier on, for recruitment of the specialized theater staff, and a shortage of qualified anesthetic officers. This recruitment and in the human resource structures. The other was to establish Roto and Masaka regional referral hospitals to enhance the national blood collection, storage, and distribution capacity, and increase availability of blood and blood products which are life-saving. The status is that these regional blood banks have been constructed, and their construction is complete. Not that it is 90%, it is complete. And His Excellency the President will be commissioning the blood bank in Hoima as a symbol for the others. The other goal was to establish a coordinated ambulance system with 14 medical call and dispatch centers and 1 ambulance command center per region. The status is that the first national ambulance station with a call center is near at Naguru National Emergency and Trauma Center. The Ministry of Health is working with Uganda Police and Uganda Communications Commission to functionalize the 911 medical emergency universal number. We have established highway road traffic accident response system together with the Uganda Red Cross, and all the highways have ambulances placed along the roads. A regional ambulance call and dispatch center has been established at Masaka Regional Referral. We have commissioned construction of 4 regional ambulance call and dispatch centers in Arua, Lira, Mbale, and Mbarara regional referrals. Furthermore, 123 Type B ambulances were acquired and deployed through the COVID-19 preparedness and response plan. These were all deployed to constituencies, in addition to those that were existing. 14 additional boat ambulances were procured for the local governments with islands, and they have also been deployed in the waters that surround these local governments. The long-term plan is to procure 5 aeromedical type C, that is intensive care ambulances. We also plan to have each of the 14 regional ambulance call centers and dispatch centers responsible for 20 to 30 type B basic life support emergency care ambulances. Maybe I need to explain that a mapping was done, and we know how many ambulances is required per region. Some regions have fewer districts, others have larger districts. So that is why some regions will have about 20, 22 ambulances based on the number of constituencies, while some will have up to 30 ambulances. Now the ambulances will be coordinated at the ambulance call and dispatch centers. This includes the specialized type C ambulances that are stationed at the regional referral hospitals. So far, funding has been provided for 6 out of the 14 call and dispatch centers. We'll now move to the neonatal intensive care units. The goal was to equip and functionalize neonatal intensive care units in all the 15, now 18, regional referral hospitals, 54 general hospitals, and 222 high dependency units in the health center force. Chairman, I didn't change this to 18 because it was captured originally as 15. That is why I keep on correcting, updating the manifesto. So the status is that the neonatal intensive care units and neonatal special care units are available in 33% of hospitals and 17% of health center force. 42 health center force were equipped and radiant warmers. 100 incubators were repaired and redeployed to the 54 general hospitals and health center force. The challenge here is still inadequate funding to ensure that all the 54 general hospitals and the high dependency units in health center force have neonatal intensive care units. However, the regional referral hospitals have neonatal intensive care units. The next, number 7, is reproductive health education, and the goal was to reduce the reproductive services burden by increasing reproductive education. The status is sexual and reproductive health education is ongoing through various media channels with support from partners. The challenge, however, is low uptake of services like family planning and also early marriages and school dropouts. Number 8, scaling up immunization. Here the goal was to scale up immunization efforts by conducting routine immunization services. The status is that routine immunization services are conducted through static sites, that is in the hospitals, and outreaches by all health facilities. We have solar-powered vaccine fridges installed in all health center 3s and a number of health center 2s. Chair, if I can explain this is to say that government has ensured that solar-powered vaccine refrigerators are available in all health facilities up to the level of a health center 3 and some health center 2s that carry a heavy burden of the population. Refrigerators are also provided to the private facilities and private not-for-profit. So vaccination coverage is enhanced throughout the country. The DPT-3 vaccine coverage was at 87% in the year 2020-2021. It rose to 91%. It dropped in 2022, but currently we are at 95%. It is one of the highest in the African continent. Is measles, rubella. Vaccination coverage trend, the last is 94% as per this financial year, with an improvement from 86% till now. MR2 coverage is still low. This is measles, rubella, second dose is still low at 16.5%, but the mop-up campaigns are ongoing, and we call them catch-up campaign, for us to catch up and bring the coverage high. Challenges: access to public health facilities in Kampala metropolitan area, especially in informal settlements. We have the biggest challenge within Kampala for children to access immunization. But there is also low uptake of services in some regions like West Nile, Bunyoro, and Ankole. COVID-19 vaccination campaigns interrupted routine immunization activities. However, we are catching up. Also, we have another program that we carry out, which is called Integrated Child Health Days in the month of April. This brings together all antigens and vitamin A, and we carry it out the entire country as a form of mop-up. Chair, the biggest challenge with immunization now are the anti-vaxxers, those who are decampaigning immunization. But let me also state here that Uganda is the country with the highest number of antigens at 13. When we introduce the malaria vaccine next year, we shall have 14 antigens. And it is one of the reasons why Uganda, within this region, has the highest life expectancy, because our people live longer, they are protected. Number 9 is deliver quality national health services. The goal here was improve the functionality of the health system to deliver quality and affordable, preventive, promotive, curative, and palliative services. The status is service readiness and availability index has increased from 52% in 2019 to 59% in 2022 based on the health facility. We have to carry out another assessment for us to give the availability index. The X-rays, I already talked about them, so I'm not going to repeat them again, but just to let you know that 20 digital X-rays are under shipment, and they will arrive in April 2024 to cover the gap availability in the health facility. Number 10 is on healthcare waste management. The goal was to establish regional healthcare waste management centers to improve healthcare waste management. Construction is ongoing at Kampala metropolitan area at Mukono, in Mbarara, in Lira and Gulu. We expect them to be completed by the end of this calendar year. Chair, the next manifesto commitment is on research and development. Number 1 is research centers of excellence. The goal was to develop the Uganda Virus Research Institute into a world-class center of excellence in health research. This is ongoing. The challenge is largely availability of finances. But we all know that UVRI is already carrying out world-class research in collaboration with many international universities, including a research on vaccine production, a research on injectable ARVs, and many others. Number 2 was to stimulate innovation in science and technology, and the goal was to support development on innovations such as incubators for locally developed medical technology. The status here is we supported development of 10 neonatal capacity incubator, which is now in use in Kawempe National Hospital. I know that many people are aware of it. The on-site disinfectant production system is ongoing. The challenge is that this concept is still new and very inadequately funded. That is why we only have this incubator in Kawempe. However, we need funding to be rolled out to the research and come is being through the National Research Institute for Management of Upper Respiratory Institute. The snail in terms of quality. Such technical working that have been set up Ministry of Health evidence been research. You will recall we have fully equipped 2 procure for all the 18. Now the reason why we are saying was that is 100 cc per hour. $60 tanks that liquid oxygen have been installed in NS and another one in Lago. Now 4 30 cc's cryogenic plants and 6 100 cc's per hour have also been procured. Those are smaller ones for other areas. Construction of oxygen plant is ongoing at the 19 regional referral hospitals where installation is being undertaken. The National Oxygen Scale-Up Strategy approved, and members can have a time to look at it. But just to let you know that when all these plants are functional, there will be no challenge with oxygen, except the challenge will be availability of power, because the idea is that the regional oxygen plants fill up cylinders for distribution per region up to the level of a health center 3. Challenge is inadequate funding for servicing of the oxygen plants. Some regional referrals, the funding was inadequate to complete the houses. And as I mentioned earlier, power supply, because these oxygen plants consume a lot of power. Chair, I think I'm coming to the last commitment, is dealing with counterfeit medicines. Commitment number 1 was to strengthen control measures, and the goal was to enforce existing controls at all levels of medicine supply chain to ensure good, cost-effective medicines. Let me summarize here that medicines are on the market. The status is that National Drug Authority has strengthened its analytical laboratory capacity to ensure the quality of medicines improve, and they are also carrying out pharmacovigilance. So testing of the medicines that quality, that is the active ingredient, to make sure that they are of the right quantity. As I mentioned earlier, the NDA has a microbiology lab that was commissioned. This one is in herbal medicines that are along Buganda Road. Regular inspection, registration of pharmacies and drug shops is ongoing. Challenges. I don't want to say continued existing gaps in the legal, in the law of NDA, because the law of NDA is at the final stage of being taken back to Cabinet for final approval and later on to Parliament. It is not a National Food and Drug Authority bill as was captured in the manifesto. It is now a National Drug and Health Products Bill, having dropped out the food component. The food component is now under Ministry of Agriculture, and Agriculture is developing a new law to capture for food and veterinary drugs. Plans for 25-26 and the medium term. And Chair, this is now the last part. I'll run through it quickly because these are the same plans that are in the Ministerial Policy Statement, in the National Health Policy and the National Development Plan 3. One is promotion and implementation of integrated high-impact interventions for prevention, control, and elimination of communicable, non-communicable, and neglected tropical diseases and injuries. Two is provision of high-quality sexual and reproductive health and rights services in order to achieve optimal health for adolescents, mothers, newborns, and infants. 3, promotion of nutrition education for communities on the benefits of balanced diets, food preparation, and the importance of nutrition, especially for children, pregnant women, and the elderly, that is the geriatric care. You will recall that I mentioned earlier that the guidelines on nutrition were developed and launched by His Excellency the President. So we are now just offering health promotion and education services. 4 is strengthening the national ambulance system, emergency care and referral system. As I indicated earlier, this is is not yet covering the entire country as we would have wanted. 5, establishment of strong primary health care and community health services, and implementation of community health strategy hinged on the parish development model approach. Chair, in here, we are training VHTs and community health extension workers at the parish so that we can strengthen primary health care services at that level. The other is construction, rehabilitation of health infrastructure, and provision of medical equipment to improve quality of care at all levels, including infrastructure development in Karamoja. The one in Karamoja is already, will commence shortly with a 10 million euros grant from the Italian government. The other is increased availability of skilled health workforce through training, implementation of the new structure, development of mixed community health workforce, strengthening regulation and performance management. Next is establishment of the national e-health infrastructure, that is digitization, to facilitate service delivery through telemedicine, e-health management information system, community health information system, including of medicines and health worker performance. Actually, here the word would be to strengthen and complete, not establish, because we've already established, and connection is ongoing. The other is expansion of health insurance coverage and social health protection through a mandatory national health insurance scheme for all residents in Uganda. We are awaiting the discussion of the health insurance bill that is currently before Cabinet. Allow me to thank you all for your attention and for the nearly 2 hours that you have given me. Thank you, Chair.
Please join me and we put our hands together for a very big applause to this presentation from the I think viewers, wherever you are, you must be able to appreciate where we stand on this journey of improving our health. And like we said, a health citizen means a health nation. Honorable Minister, allow me to thank you and your team for this elaborate, insightful, and which was very well structured as outlined in the manifesto. Allow me now to pass on our observations. First and foremost, we want to congratulate you and your team, I think, for a job well done. There's really notable progress in this area. And by the way, maybe because you did not also touch in particular on some of the improvements in the health indicators, these investments are really translating into some health indicators which we can ably be proud of as a country. First of all, I and my team, because we move across the country from time to time, I want to assure viewers that most of the infrastructure investments that the minister has talked about here do exist. They are there. And I also want to appeal to our leaders, especially local government leaders who are down there trying also to engage with the media and our citizens in whatever form, whether you're at a burial, in church, or on the radio, to break down this further and try. The minister was trying to give us the global figures at the national level. But each district must be knowing, when you break down, what is it that you have, that has been brought down up to your level. That's when the manifesto can be meaningful to the citizen as far as this sector is concerned. So if you are from Bushenyi, or you are from Kotido, or you are from Lango, say Dokoro, the question is, how many in your sub-counties are you witnessing construction of health center 3s? How many in that area, how many health center 4s have come up? How many general hospital has come up? How many within that region, regional referral hospital has been refurbished? And all these infrastructure developments she's been talking up here can really be explained for the citizens to understand this journey better. So we want to congratulate you, Honorable Minister, and your team, and identify with the achievements, and to say that a strong health sector is a good basis to enable development through human capital development. Note that I said there are already some indicators like the life expectancy, which has now moved higher from 65.8 in 2016 to 67.7 in 2022. We see death reducing and other indicators, which was a progress in our health development. We want to appreciate the ministry for enabling the country to contain and overcome the COVID-19 pandemic and the Ebola epidemic. And I think many of you who are still alive here can attest to this, that you put in a lot and you were able to save many of our lives. I think that one was really a big applause. And also to thank His Excellency for him being a visionary and guiding the country through the process. Because I believe at one some of these laws becoming an issue emotionally to some of us, the citizens. But later, the bigger picture was able to be realized. So government through the NMS has also improved the procurement and delivery of essential medicines. This is very, very critical for the country. We appreciate the improvement in personnel, those in special various fields, and we join you to thank your sector and government for these I hope there is somebody here who will be picking observations. Okay. So, and also to appreciate the sector in terms of human resource development. We have seen many scholarships. Require special various parts of the country, so that this is not and especially areas of vaccine development. So we believe this is an area, and you saw already science has a commitment on pathogen economy. So this kind of linkage with the Ministry of Health must be applauded and supported. The various structure, like I said, we have moved the whole of this country. We have seen this existence of these health center 3s, health center 4s, the upgrades, the rehabilitations, the added infrastructure within these facilities, I mean, in as far as functionality is concerned. So we want to salute those efforts. The expansion of treatment centers for non-communicable diseases like cancer and heart conditions to regional hospitals I think is a very, very positive direction. You know, breast cancer has become a very big issue in the medical challenges of the country. So to expand and make sure that the regional referral hospitals are supported with infrastructure which can manage some of the initial tests and the related treatments, I think is a good direction for the country. We want to salute the health system that is PhDs, especially at the lower levels, like at the parish levels, which help in the initial disease surveillance and other first aid engagements of some of the common diseases. However, I want to say that we have seen, Minister has said this issue of oxygen, yes, the oxygen plants, but I think there is still a problem here. Some of these, we still have an experience where oxygen presence in some of these referral hospitals is not there, much as we are seeing a lot of investment in making sure that oxygen should be available or should be available at these health centers. Maybe this needs for a follow-up so that citizens do not find themselves in a contradiction where we have assured them that this is an investment we have made and there is availability of this oxygen, and yet they go to these hospitals and don't find this oxygen. Otherwise, and I think we are also would also like to know, I don't know whether the minister talked about it, how far we have moved on the specialized hospital of Rubowa. Yes, you did, thank you. I think we see progress in that area, and as you are aware, the country is continuing to spend a lot of money. Citizens, I may say, continue to spend a lot of money going for treatment. So the presence of these high-level cases is a move. So allow me to invite you, members of the audience, especially our partners, the media, to raise issues. I'm happy the minister is back, and then we can proceed from there. Thank you. Yes?
Yes, Madam Minister. Thanks for the report. It's really enticing. It shows that the Minister of Health is doing something good. I'm rolling my hands up for very. My question is about the last point Mr. Bashasha talked about it at the Lubowa Specialized Hospital. Government have spent millions, billions of shillings and dollars, but when health committee tried to go to Goa to do some inspection, they were not accessed. What would be hidden there? You said that, but what would be hidden there? I remember one time even your team was denied to access that hospital. Thanks.
Thank you. Next. Yes. Today you have sat far. Uh, can you proceed? Can you please speak loud and make yourself clear?
Okay, the minister said they need funding to upgrade more health centers from health center 2 to 3, and that they are left with about 418, which they want to do, but they don't have the money. So I'd like her to highlight more about that and which districts are we starting with or going to focus on in the next year.
In short, you want the list of the
411.
targeted, the mapped 411. Okay. Go ahead. Yes.
Thank you, Honorable Minister, for the wonderful presentation. My question is around the growing mental health challenge among the youth. Does the ministry have plans, or do you have any strategies to deal with this problem? Thank you.
Okay. Thank you. I think that is okay, but maybe the manifesto had not looked at it. Maybe in the new manifesto we need to emphasize the issue of mental health as a challenge within our country. Go ahead, but the minister will respond. No worries.
My name is Lawrence Koko from UPC Radio. Recently, there have been a number of retired medical students who were not deployed. I need an update on that because the ministry also had a point of recruitment of medical officers limited and also limited qualified staff. We cannot have qualified staff if we don't recruit. What is the ministry doing in that position?
Okay, thank you. Yes, this side.
Thank you, Honorable Minister, for that presentation. My name is George William Katalaba. I work with NRM FM. Honorable Minister, you said you want more wages for the superintendents of medical hospitals. How much is required? Then on the 45%, on the construction of the lower hospital, how much is injected so far? Thank you.
Okay, next.
Thank you, Honorable Minister. I'm Julius Mugabla, Kachong Royal Office of Model Standard. Mine is just simple. You talked about the type C specialized ambulance. I would like to know the coverage in the country. Because a few epidemiologists talk about this, but looks like the statistics didn't come out clear. So I would like to know from you the coverage in the country. And secondly is the issue of the neonatal intensive care unit, which you say it is at 38% in hospitals. And when you look at the statistics, there are many prematures that are born worldwide. So the 38% looks to be little. I would like to know your plans to save these lives because these are critical conditions that need serious care. Thank you so much.
Okay. Oh.
Thank you. My name is Mujibra Zavia. I work for NRM Radio. Honorable Minister talked about the salary enhancement of the doctors, but we've seen several times doctors on strike. They want money. Today we even have a slogan that is moving on social media. Twagala sent. Twagala chinchina twagala sent. Thank you.
Now, what is going on social media? Can you be clear? Because what should the minister answer? You are like saying doctors are on strike. Is this true or false?
No, the Honorable Minister talked about salary enhancement.
Yes.
That in 2021, 2022, earlier was salary enhancement, but we see doctors on strike. We want money. We want money. Let her clarify that.
I thought that was handled. Okay, the Honorable Minister will answer.
Thank you.
Switch off the other one.
My name is Felix Brian Okesho. and it's smooth. Honorable Minister, we have written about health insurance. When are we seeing health insurance take effect?
Okay. It'll be the last. Hey. Okay.
Thank you. My name is Olivia Harold. I work with the UBC. Honorable, just in a few days we shall be commemorating the World AIDS Day, and experts are always talking about limited domestic funding, and we are talking about elimination of AIDS by 2030. How is our domestic funding towards HIV? And when someone talked about mental health, we just recently also commemorated the World Mental Health Day, and Sector keeps telling us towards at 1%. What is the commitment of the country towards elimination of such diseases accelerating towards 2030? And maybe lastly, we have I think we are health facilities of health workers. If you're able to take the patient in the night, you may sit with your patient up to morning without a little work. So someone said that they let the patient in the night. At 6 it was a weekend. No person was there. They had to wait up to midnight, no person. So they rushed this person to the private facility with the hope that in the morning the person maybe will be there. And in vain, even in the morning, in this public facility, the workers had not reported. This patient had to maybe to be called by the computer. We are having site events in the facilities. What is your take on this economy?
Okay, thank you. Chugundu. Okay.
Let me thank the Minister for the wonderful presentation. My name is Lynn Kachigondo. I work for Spotlight, an online media platform. My question is, we see so many traditional healers and other groups of people administering medicines, especially the herbal type of medicine. Some even claim to be healing cancer, healing other serious diseases. So my question is the Ministry of Health the one giving licenses to these people to administer such medicines, or these people are doing it on their own? My second question is the Ministry planning to have a kind of a national health database system for the citizens, so that in case maybe if I go to for some medicine, I can, if I go to Mbali, they can my health, how can I health, so that I don't just be given medicine like differently. So my question is the Ministry planning to have a national so that all health people and unhealthy people can be really got to be understood by the different health centers? Thank you.
Thank you very much. I think that marks the. Oh, Kale, last one.
Thank you so much. I'm Fred Kayombo. I work with Uganda Radio Network. We see stock out of residential medicines. My question is, what is the ministry plan to restock some of these medicines, like the one which is used to prevent bleeding when the woman has given birth? It is called you stock gross stock. This has been seen in Budaka health centers. What is the ministry doing to restock some of those essential medicines?
Okay. Thank you very much. Allow me now, Honorable Minister, to invite you, and you respond to these. And you are also at liberty to invite any of your technical staff to support you in some of the responses. Thank you. Oh, okay. Just come over here because it is being streamed live and people would like to have the answers. Just come over here.
I'm called Engineer George Otim, the Commissioner Health Infrastructure, Minister of Health. I'm not a medical doctor, so I'm going to answer only one question on Lubowa. The construction progress at Lubowa is at 45%, like the Honorable Minister stated. And she also stated that by the end of next year, the hospital should be commissioned for us to start getting healthcare services from there. There was a question on, you are talking of 45% of work. In terms of money, how much is that? We have paid also 45% of what is due. In construction, you are paid for what has been done. So we have paid 45% of the contract sum. Thank you very much. I think access can be granted. Access can be granted. There's nothing hidden, because right now, as you are driving along Entebbe Road towards Entebbe, you can see the structure. There's nothing, meaning there's nothing hidden anymore. Thank you.
It seems you think there is gold there. But if you want access to Lubowa, alert us. Because according to the PWA, the Project Works Agreement, we have to alert the contractors early so they can prepare for us. There are over how many contractors are on the ground? How many people are there in Lubowa?
Currently, we have about 800 workers working day and night.
Yes, so you have to alert them early so they can prepare for you, stop other areas, sort out where you're going to pass, and that is what is required as per the PWA. The first question I captured, I hope I haven't missed any, was on upgrade of Health Center 2s to Health Center 3s. Chair, maybe, did you have questions?
Some observations.
Or observations? You captured the chair's observations? You will make it available to me. The 488, not 418, 488 that are still pending, yes. You cannot get money at once to cover for everything. There are so many undertakings, and it is not only Ministry of Health that needs resources. At least we should be extremely grateful that we have covered a large part of the country. We are left with 488, which will be undertaken when resources are made available. The majority of this, as I said before, was because of increase in the number of sub-counties, the newly created sub-counties, which were carved out of existing ones. So that is where we need to put new health center 3s. So it is not as if they don't have anything. They already have existing facilities, but because it is a sub-county, it needs a new Health Center 3. The second question was on the growing mental health challenges and what we are doing about it. Yes, we are very much aware about the growing mental health challenges, and it is majorly due to drug abuse among the youth. And that is why our facility at Butavika is heavily loaded. But many of you will recall that government did construct mental health facilities in the regional referral hospitals, and medicine is being made available. The only challenge is availability of resident psychiatrists. As I mentioned earlier, we have a challenge with specialist psychiatrists, majorly within Kampala. We need more trained so that they can be deployed as resident psychiatrists within the region. However, the most important intervention currently is education and sensitization, for people to know that you get involved in drugs and many other issues, you will end up with a mental health problem. The third question was on deployment of intern medical students. Why are we deploying some and not all? Maybe I need to remind you that the number of universities increased from 5 to 31. That is a big leap, and therefore a huge number that is being trained from these universities. Now that number needs planning for. We need to expand the number of facilities that are training interns. I already talked about challenges with specialists to supervise the interns. And the guidelines for interns is very clear. Those who can supervise specialists are consultants and above, and those numbers are still limited. Furthermore, we have challenges with universities that enroll twice in a year. Ideally, a university is supposed to enroll only once. So when you start receiving over 2,000 interns, you can't deploy all. We don't have that capacity. And so we deploy per calendar year. Those who come out are deployed. Others that are coming out after, like from universities that enroll twice a year, have to wait. We don't have capacity of specialists to supervise them. So that still needs to be planned for. We have been having interactions with the universities because the Council for Higher Education gives limits as to numbers that should be enrolled at any one time, but most universities are not adhering. Number two, the numbers that are trained have to be according to our need. But His Excellency the President, in his wisdom, said we are not only training for Uganda, so let us train. So the numbers go over and above. To address this, the Ministry of Education, because all this is under the Ministry of Education, has developed a clear policy that will guide the country on the issues of interns and how to address the number of new interns that are coming out. And I want to believe that very soon the policy will be discussed in Cabinet. Now, on the issue of recruitment of qualified staff, I think I mentioned very clearly in my presentation that we don't yet have enough wage. Now, you need to remember, all of you, that wage is a expenditure. You don't pay it as a one-off. Once you start paying wage, you will pay it continuously every month. And in addition, you have to be. And what is the other part of pension? Gratuity. So that needs to be planned for. So you just don't go and recruit without planning. And since we are just out of a very big pandemic that caused economic challenges in all countries in the world, you cannot talk about mass recruitment at this point in time. We have so many other undertakings. The President is talking about the railway, he's talking about energy, he's talking about roads, So you cannot combine all at the same time. However, as I mentioned, recruitment is ongoing, however small the numbers. Somebody asked about, no, Luboa was answered, the coverage. No, the question was how much wage we need. I can't remember off-ed because the restructuring was massive. It is in trillions of shillings. But if you want that information, you can pay a visit to the Ministry of Health or the Ministry of Public Service that guided that we shall recruit in a phased manner, and you get the total amount of money that you need, but it is in trillions of shillings. Now, coverage of Type C ambulances. I hope you heard me very clear. Type C ambulances are mobile intensive care units. They are only deployed to regional referral hospitals, to national referral hospitals, and to the specialized facilities. And as I mentioned in my presentation currently, for the regional referrals, only 5 have Type C ambulances. We are still in the process of procuring for the other regional referrals. However, it doesn't mean they don't have ambulances. They have the Type B, basic life support ambulances. The national referral hospitals have the Type C ambulances, but not all of them. Mulago has, Cancer Institute has, Chirudu has. I don't remember the other one offhand. The other question was about neonatal intensive care units and the plans to enhance. If you recall my last presentation of our plans, long-term and medium-term, I think I talked about scaling up of neonatal intensive care facilities in all the regional referrals, the general hospitals, up to the level of a health center 4. And I said currently, the challenge is availability of resources to do this. Salary enhancement of doctors. Doctors are on strike. Sebo, I have not heard of strike. I would be very glad you explain where the strike is. But what I know is that salaries were enhanced from the lowest level, the medical officer, to the level of a consultant who is currently earning about 15 million, and all the nurses and all the allied health professionals and all the other cadres, salaries were enhanced. Maybe you should have been asking me, is their performance in tandem with salary enhancement? That should have been the question. When are we concluding on the national health insurance? I was clear in my presentation. I said the bill is back to Cabinet for consideration. As soon as Cabinet discusses it, it will then go to Parliament, and Parliament will debate it, and when they pass it, then the President can enact it. The other issue was on domestic funding for HIV. Where are we? Maybe this question was in relation to the HIV fund. We are not yet implementing the HIV fund, but government has a commitment to enhance funding for HIV by 100 billion shillings every financial year. And government has been doing this very religiously. 100 billion shillings for HIV commodities every financial year. Government has been doing it. So far, we have covered 5 financial years, and it continues to do it. You can verify this with the national medical stores. You will see the increments in the budget of national medical stores for HIV. Funding to mental health. Mental health is wide. You cannot have single disease funding. Single disease funding was introduced to our country by partners when they brought HIV, TB, malaria. What we believe in is integrated services to the people. Because you cannot treat a person as a disease. You treat a person holistically as a person. So when I come to you and I tell you I'm not sleeping at night, I also have a fever and many others, you treat me as one person. And whatever you discover, you treat. So we are not going to have funding ring-fenced for mental health, funding ring-fenced For cervical cancer, funding ring-fenced? No. What government provides is holistic funding, and we are now pushing even our partners. We are saying we are no longer interested in support to single disease entities. We want integrated service delivery. Workers, yes. There is a lot of absenteeism because of dual employment and because of people who have private clinics and so on and so forth. What we are doing right now, as I mentioned before, digitizing the health sector, which is in high gear, is one of the tools that we are using to track performance. So you go into your workplace, you clock in, notice taken. Every patient that you attend to, you have to enter that into the computer. At the end of the day, we quantify your performance based on the key performance indicators that have been set up that I alluded to earlier on, and then we shall had to link with public so that we can track and see indeed what is to you. The issue of additional healers, do we license additional healers? The person is Ministry of Health licenses to anybody. We are not a license giving ministry. The roles of the health sector are very clear. We handle policy, we handle strategy, we handle support supervision, we handle resource mobilization, we handle guidelines. So there are other entities that give out licenses. Now there is a very clear traditional and complementary act that is being implemented under the National Chemotherapeutics Research Institute. But just to tell you that nobody is giving licenses to these traditional healers, but they are being mapped out, and in future, when we conclude the National Drugs Authority law, they will be regulated under the National Drugs Authority. It wasn't there in the previous law. The law is revised. It is now ready to go back to cabinet. So they asked about the National Health Data Bank for science. Yes, this is actually incorporated into the National Health Insurance Bill. It is not mandatory that we should have your information, because patient information is private information. But the way this will work, it will be linked to the national IDs. When you go to a health facility, you clock in your national ID, your number will be read, and your but that will only happen after we have operationalized the National Health Insurance Scheme Bill. However, capturing data is now ongoing using digital systems that we are setting in place. The last question was on restocking misoprostol. Sebo, I want to request that you go and check. Misoprostol is available. It is available in the facilities. I thank you.
Do you have any comment? Okay. Thank you very much. Once again, a big applause for the Minister and his team. Honorable Minister, thank you very much for your presentation and response. I think we have now come to the end of this session. I want to thank you, our team, our viewers. Keep glued to the screens wherever you are. We shall be back here at 2:30 with another presentation. David, who is coming next? David. Hey, Marvin, huh? So we'll have Minister of Local Government at 2:30, so let's assemble here and then listen to the story of how far we have gone in that area. So Honorable Minister, we will invite you for a photo opportunity outside here, and we want to thank you for your presence. Can I ask you to raise for the anthems in a reverse order? Okay. Thank you.